Now, before I go into the specifics of IIN, I think it's important to touch on my personal journey towards becoming a health coach and why I am so convinced of this model and why I think it's such a powerful thing to do. So, as most of you guys know, I had a really tumultuous relationship with food and my body for many years in my teens, and I dabbled with anorexia and then bulimia, binge eating, compulsive eating, um, orthorexia, really all of that mumble jumbled into one big mess. When I hit rock bottom and thought something needs to change, I did a couple of things. Initially, I tried working with psychologists, and I tried 2 different ones, and unfortunately, it just didn't resonate with me. I don't know, I didn't gel with the person. I felt judged, misunderstood. I just didn't vibe. So I tried 2 different ones and then kind of gave up on that. And then somehow, just by chance, I stumbled across a holistic health coach whom herself had had an eating disorder for many, many years, and she was offering coaching specifically in that field. And so I gave that a go, and that was what kickstarted it all for me. Working with someone who had gone through the same issues that I was currently going through, that's all I needed. I just needed someone that was able to create the safe space where I felt heard and held and understood, and basically was able to create this non-judgment space where I was really able to be vulnerable and share all these things that I'd been holding in for such a long time. So it was through working with her that I really began to heal my relationship with food and my body. And as I was getting better and better and kind of refinding myself, I started talking more about what I'd been going through. I started sharing first with family and friends, and then with strangers, and then on social media. And it was around that time that I started to realize, hold on a second, there's actually so many other people, especially young women, who are going through this exact same struggle. And we're all kind of just struggling in silence because no one's talking about it. And by me opening up about it, actually talking about it, it created this safe space where people came together and started sharing their stories. And I had so many people, especially from like my uni back in the day, reach out and ask if we could, meet up, grab a coffee, and um, maybe share some input and share some advice, because they didn't really have anyone else to turn to. And I guess, like many of them didn't feel comfortable just talking to someone who hadn't gone through the same thing. So it was really powerful for them to talk to someone who could relate on that deeper level. That's really where it hit me, that I wanted to use my story and my struggles to help other people, much like my health coach at the time helped me work through my struggles and managed to do so beautifully simply through having gone through the same thing and sharing her story with me. I guess I I felt so judged and misunderstood by the traditional paths that I tried, that working with someone who'd gone through the same thing was such a breath of fresh air. And that's really, really all I needed, was just to work with someone who had gone through the same thing and who could relate. That's all I needed. And that's why today I'm such a huge believer in A, the power of vulnerability, just share your story. B, that your mess is your message, really and truly. Your mess is your message, and if you can use what you've gone through and share that with other people, that isn't only self-therapeutic, but it can help so many people potentially down the road. And I really truly believe in the power of working with someone who can relate on that deeper level by means of having gone through the same thing. And so I think this is where health coaching is so powerful and can come in so beautifully, because you can find someone to work with that's gone through the same struggle and can relate on that deeper level. And so basically, in a nutshell, sorry, I'm rambling a little bit, I decided to do my holistic health coaching certification through the Institute for Integrative Nutrition to help other women struggling with disordered eating. And, I had looked at potentially doing a nutritionist degree or potentially studying psychology, but that didn't really sit right with me. I didn't want to become a nutritionist, and I also didn't want to be like a full-blown psychologist and spend another 5 years studying. So I was really looking for something that was a health coaching degree with a focus on nutrition, but then also incorporating all the holistic things that I've mentioned. And of course, it also brought in coaching techniques, because it's so important when you work with people to be able to create that safe space for them, hold them accountable, and be an active listener, ask the right questions, all of those things that you need in order to really ignite change within someone.